It's 8:03 and quite a few have logged in already, so we'll begin. So for those new faces here tonight who haven't logged in yet this summer, so I'll just introduce myself first. So my name is Ida Valavicius, and I have been the host for the Summer Speaker Series this summer. I'm a postdoctoral student at McGill University and at the INS in Quebec, so one of the Canadian Sport Institutes in Montreal. And I do research mostly in biomechanics and some female athlete health as well. If you have any questions regarding the series, you can always reach out to me. And today's speaker, I'm very excited to hear her presentation, is Dr. Gabrielle Ostiguy. And I will quickly introduce her, but before I do that, I just want to go over some housekeeping for the session tonight. So the session is being recorded and will be posted on the YouTube channel for anyone who missed it to rewatch later. However, it's only the presentation portion that will be posted online, and then the Q&A period will not be posted online. So during that time, feel free to ask any questions you'd like, and you can unmute yourself and turn on your camera as well to have a discussion. So for the questions, you can use the chat box for your questions throughout the presentation, and then I'll just read them out to Gabrielle during the Q&A period. And during the Q&A, you can also use the chat box. You can message the group directly or myself directly. And you can also unmute yourself and just ask a question as well. So that's pretty much all I have to say for the housekeeping stuff. So without further ado, I will introduce Gabrielle, and she will take it away for a really exciting talk. So Dr. Gabrielle Ostiguy is a family doctor specializing in sport medicine in Montreal. So Gabrielle completed her medical training and family medicine residency at Laval University in Quebec City. She then completed in 2014 a fellowship in sports and exercise medicine at McGill University and obtained her CASEM diploma in sport and exercise medicine. So Gabrielle currently works in Montreal, and when she's not working at the walk-in clinic, she works as a sports medicine doctor with several different sports teams. So Gabrielle has been the team doctor for the Concordia McGill's hockey team, and now she works at the McGill Sports Medicine Clinic as a team doctor for cross-country and track and field, and at the Institut National du Sport du Québec as a team doctor for short track speed skating, judo, and Olympic boxing national teams. So one of Gabrielle's biggest career highlights is that she actually went to the last Winter Olympics in Beijing and was a team doctor for the short track speed skating team. So Gabrielle is also an avid cyclist in her time off. She is still training regularly in road bike, gravel bike, and also mountain bike. So please welcome Gabrielle for her presentation inspired by clinical work that she does with athletes.
Hi, thanks everyone for being here. Thanks Ida for the introduction. So I'm going to share my screen to start. All right. Okay. So yes, so I'm very happy to have the opportunity to talk to you today about female athletes' health and well-being. Before we start, just a quick disclaimer. So this talk is intended to be for information purposes only and not intended to be a substitute for professional medical advice, diagnosis, or treatment. So before we start about the topics, so the goal of the presentation is really to give information to athletes, runners, any type of athletes about like women's health topics, things I see in my clinic, just to raise awareness about those things. So it's not intended for health professionals, and so if you're a health professional, you might learn some things, but I'm not sure. But yeah, so that's it. So I'm going to talk about common nutrient deficiencies, about injuries, pelvic floor dysfunction. Things I'm not going to talk about are RED-S because it's going to be the topic of a whole presentation, another presentation. I'm not going to talk about menstrual disorders, contraception, because it also was a topic of another presentation. Two things I'm not going to talk about that I think are very important are mental health and overtraining. So that's it. Then we're going to start about nutrient deficiencies and dietary supplements. One thing I wanted to say is that, and makes it difficult, is that there's no like consensus about what's like normal, what are normal limits, normal values in blood for an athlete. I mean, we kind of know for normal population, but for an athlete, there's no real consensus. And so it's hard to know what's optimal, what's normal for an athlete, what's relative deficiency. That's why there's not many numbers in my presentation. So I think it's more a case-by-case thing, and that's it. Yeah. All right, another thing I wanted to mention is okay, so the use of supplements is widespread at all levels of sport. And supplement, they can benefit to the athlete when they're used like appropriately. But supplements should not be used as a substitute for healthy and adequate diet. And supplements should not be used to treat symptoms without a clear diagnosis. Like we need a justification to use supplements. We need a nutritional and medical assessment to justify it, and there need to be a reason. And supplements may contain also prohibited substance that result in anti-doping rule violation. I know that Chloe talked about it in her presentation, but there's that IOC consensus statement that I find really interesting if you want any evidence-based information about supplements. And there's also like a tool you can use to determine if a supplement is good for you, if you should take it. For sure, it does not like you need a medical advice, nutritional advice, but I think it's a really interesting like reading, and it's easy to have access, and it's easy to read and not too long. So yeah, you should read it. So let's start with vitamin D. Vitamin D is something like we all know about vitamin D. So with the sources of vitamin D is really skin exposure to sunlight. So that's why we say that we get it from sun, but it's just that the vitamin D is synthesized through the skin, like when the skin is exposed to sunlight. So there's also some food that can provide vitamin D. But what's important is because vitamin D is really important for bone health and the immune system. So what are the causes of vitamin D deficiency? Well, most of the time it's really like that there's less skin synthesis of vitamin D. So sunlight exposure, like here in Canada during winter, that's a really clear and easy example. Also the use of sunscreen. Well, we all know that sunscreen is important. So for sure, I will recommend that you all use sunscreen, but it's not good for vitamin D synthesis. And also dark skin. So the melanin in the skin acts like a sunscreen. So people with dark skin or darker skin tend to have less synthesis of vitamin D. So that's another important cause. Then screening and supplements. So there's no consensus on screening for a healthy population and for athletes. Yes, it can be measured in blood tests. It's easy to measure. Well, not that easy here because some labs here in Quebec, Montreal, they refuse to measure it if there's no there's no reason that is sufficient enough to measure it. So, but it could be easy to measure it. There's the optimal blood concentration in athletes would be, I would say, around 75 to 100, but there is no consensus for this again. I think that when I see a value around 100, I think it's good. There's enough. It's reassuring too. And there's no supplementation guidelines too in athletes, but I would recommend to take like around maybe 1,000 units per day, international units per day, or 10,000 per week. It's easy to take, usually not much adverse effects, and that's it. You have to be careful too because there's high dosage can lead to toxicity, so don't take too much. But that's what we recommend for athletes in general. Then calcium. So calcium, you don't get it. The cause of the deficiencies is if you don't take food or dairy product in general. there's also restricted energy intake or disordered eating. And blood test is not good to measure calcium just for screening because it's not really reliable. It doesn't really show if you're in deficiency or not. So I don't recommend to do it just to screen for a deficiency. Recommendations that are also in the IOC guideline I mentioned before is to take 1,500 milligrams per day plus vitamin D to optimize bone health in athletes with low energy availability or menstrual dysfunction. So I think that female athletes with endurance sports are more at risk and should follow the recommendations. Then the word that is really hard to pronounce in English, the iron. I'm gonna try to say it properly, but yeah, so it plays an essential role in transport and delivery of oxygen. So it's really an essential nutrient. Why? Because it plays it's there for the production of hemoglobin and myoglobin, and the hemoglobin, it carries oxygen from the lungs to your muscles, and the myoglobin kind of is a storage site for oxygen in your muscles. So mainly it's just that if you have iron deficiency, at some point you will not be able to produce hemoglobin properly, or not enough. So you're not going to be able to carry enough oxygen through your muscles, and then you start to have symptoms. We'll talk about the symptoms later. So that's what red blood cells look like when they are iron deficient. They are smaller, more pale. That's in iron deficiency anemia. So I put a little graphic about the, I took an up-to-date about the regulation and absorption of iron, just to show you a little bit more, but it's absorbed through the gastrointestinal tract. So you need to take food with iron. You can take it from, you can synthesize it from skin or something else. And it's stored in your body, and we measure usually the ferritin, because the ferritin is a storage protein, and it's really a reliable marker for iron deficiency. So there's three big reasons why you can be deficient in iron. That's for athletes, and well, for general population too, but there's also other causes here that are not for athletes I didn't put. Well, first of all, there's inadequate dietary intake. So if you don't ingest enough of it, it can be because of just general increased requirements for athletes. But it can be also from energy restricted diet, also eating disorder, low energy availability, or RED-S. And also if you take more plant-based iron sources. So if you if you're a vegetarian or a vegan, if you don't, you need more iron from plant-based iron sources to, it's just less bioavailable, so less well absorbed if you want. So you need more to be equivalent of the same amount of iron you would take from animal-based sources of iron. So if you're a vegetarian or a vegan, if your alimentation is vegetarian or vegan, you can increase the absorption too if you take it with vitamin C. So very colored fruits and vegetables, it helps. Then there's a reduced absorption. So if you have a disease that causes malabsorption, celiac disease, other medical conditions. And there's also the epsilon hormone I wanted to mention. I will not go into many details, but it's when it's increased, it kind of decreases the absorption of the iron in the gut, in the intestines. So the epsilon hormone increases after training in the hours after. So an hour after training is maybe not the best moment to take a meal with a lot of iron. Well, you can take it, but it's not going to be as well absorbed. And then there's an increased loss of iron. So for sure, menstrual losses. So every woman with menstrual losses, every time you lose blood. So it's blood that is not stored in your body. And you can lose it from sweat. You can lose it from foot strike because the red blood cells, they get destructed. And then you can lose it also in urine or in the gut. So you can lose blood from the gut because let's say that you do high endurance training or like training that is longer or very, very intense, there's less blood flow to your gut, and then there usually that doesn't cause symptoms. It can, but usually it doesn't cause symptoms necessarily, and it's reversible too. But you can lose a bit of blood from that. And one thing that increases the risk of having that is when you take NSAIDs. So be very careful. So it's in real life, I mean, it's usually all the risk factors, they're all kind of together. One athlete, one person may have different factors together, so it increases their risk. So what are the symptoms of iron deficiency? The symptoms, like at the beginning, it can lead to no symptoms at all. So, so that's what makes it difficult. And then it can start with like fatigue, low energy, and people tend to associate it with other things. Like I didn't sleep well, I had a lot of work to do, school. So like they don't tend to see like a professional. And sometimes they even tend to train more to feel like they feel better. So it can also cause decreased exercise tolerance and a decline in performance. So then people tend to work to train even harder. But it also leads to poor recovery. Then headaches, restless leg syndrome, and well, eventually shortness of breath, palpitation, chest pain, mostly when it's associated with anemia, so low hemoglobin. So the symptoms are not really specific. It's the symptoms of also many other medical conditions, thyroid problem, like mental health issues, psychological disorder issues, like and everything I mentioned before, eating disorders. So that's it. It's not really specific. So how do we treat it? Who should get tested? That's also, there's no big consensus for this too, but in general, for sure, we should treat athletes with symptoms and at high risk. Also before altitude training, it's important, a couple of weeks before. So should we treat or screen every, not treat, but should we screen every high level athlete? I think that it's really reasonable because like they are considered at high risk, I think. When? So then, like in the ideal world, at baseline, it's good to have like values when you're rested after a big training block to see what it is then. And then 6 to 8 weeks before an important event, just to make sure that if there's anything you need to do, then you have time to do it before the event. But that's sometimes really hard to do. For example, you need to see a doctor, you need to get a prescription, then you need to book an appointment. Right now here, if you want to book an appointment at the hospital for blood tests, it can take a month before you have the appointment, then you have to see a doctor again. So it's not really like easy to do. I think that like it would be good to do just a blood test at baseline if it's possible for you, just to have it checked. So it's a blood test. We check for CBC, like hemoglobin and ferritin levels. There's other markers that could be done, like transferrin and other things you might have heard about, other things we can test in the blood for iron deficiency, but the ferritin levels are enough usually. How do we diagnose it? Well, usually around less than 30 to 40 is a deficiency. It's considered a deficiency for an athlete. I think what's really important to check is like the trend. If we are lucky and we have other lab results, we can compare and see what's the trend. And for sure we should address and assess the individual risk and risk factors and make a decision. So it can vary depending on the athlete. And then iron deficiency anemia, well, we have low hemoglobin, we already talked about it. So what's the management and the treatment? First of all, like we need to identify what's the cause, because if we don't identify it, then the treatment could work with supplements, but it might not work as well, and it might not work. So I think a nutritional assessment is really important in a medical assessment. And the goal is to replete iron stores and cause a resolution of symptoms. So what do we do? Well, for sure, apart from like all the nutrition things that can be improved and other things that are not supplements, we can prescribe supplements, and supplements usually work well. So by mouth is preferred unless they are really not tolerated or unless there's really severe anemia. And how there's many supplements available. The way to compare the supplements between them is to check the dosage of elemental iron, and then you can take it daily or every other day. But the adverse effects are usually gastric irritation, nausea, constipation. So usually what I recommend is to take it every other day to avoid gastrointestinal symptoms. But some athletes, they tend to forget if they take it every other day because it's not part of their routine. So then sometimes we take it once a day. So we have to discuss with the athlete about this. And then on an empty stomach and with vitamin C is better. So, there's all this sometimes might cause a headache just because it seems complicated to take the iron supplements. When should I take it? So when you see a doctor and you have a prescription for supplements, I think it's important to talk about like, when should I take it? And so because it's not that complicated, and I think that it's some athletes stop to take it because they just feel like it's complicated to take it because they don't know when, or they have adverse effects, but we're gonna talk about it a bit later. And when should we do a follow-up labs? In 3 months, it's good because it gives time to see if it works, if we should adjust or change. One thing, iron supplements really in particular should not be taken as an insurance policy. I've seen athletes, they take supplements for 2 years just because they want to make sure that they have everything they need to perform. And I can understand, but I really don't recommend to do it, and mostly for iron supplements, because iron overload can be harmful. It can cause vomiting, diarrhea, and even liver failure. And it can really mask a more severe disease. Or another medical condition that we cannot diagnose if you take supplements and you kind of mask it. It's hard to help you. Now, how to manage adverse effects? Well, there's to take it every other day. You can take it with food or milk, but that may reduce absorption. At the same time, it's better to compared to not to take it at all. You can switch to a formulation with a lower amount of iron. You can just switch to another formulation. Something works better for someone else. And I mean, everyone's different. So there's many formulations available. You can treat also the constipation. So I wrote something here, but there's also the use of a stool softener powder. So that's kind of laxative, just to say, don't take laxative pills to help with constipation unless it's recommended. And the stool softener powder I just wrote there is because it does work and it's something you cannot get dependent on. But I don't recommend you use it unless your doctor or your dietitian recommends it. And also sometimes like athletes start the supplements and they stop because they have adverse effects, and then they have the blood test after, and I see them after the blood test and like it doesn't work, and then like just because they don't take it, like they forget to take it, or they take it, they just stop to take it, or they take it like once or twice a week to avoid the adverse effects. So it's not going to work that way. So usually we can find a solution or a way to really reduce the adverse effects. So I recommend that if you start to take the supplements and you have adverse effects, just see your doctor or your dietitian again to talk about it. All right, so now we'll talk about vitamin B12. There's many sources of vitamin B12. And plays many different roles, formation of red blood cells, development of brain, nerve cells, and who's at high risk of deficiency. I think it's like if you have a good, like varied, like non-vegetarian or vegan diet, you should have enough vitamin B12. Even if sometimes I do see vitamin B12 deficiency in that population. But for sure, if you have a vegan diet and strict vegetarian diet, you are more at risk. Or if you have like a malabsorption syndrome, for sure. not syndrome, but a disease. So vitamin B12, it can cause many symptoms and signs that are even more like, they're really not specific to weakness, fatigue, mood disorders, sometimes like weird neurologic symptoms. Yeah, so it's the symptoms. How do we test? It's blood test to test for vitamin B12, plus or minus the folates. I'm not going to talk about this here today, but like also here, like if we want to test folates, it's a bit complicated. And vitamin B12, I think it's a really good like test to do just to start. So who should we treat? Like for sure, if there's a history of deficiency, someone that's vegan or vegetarian, or someone with symptoms or with a medical condition, I think we should not treat. Sorry, we should test. We should test. And should we screen everyone? I think. Well, I do it. I ask for vitamin B12 for athletes at risk. That I consider at risk, that are not necessarily vegan or vegetarian or with symptoms. But if we do a test and it's normal, we don't really need to repeat it. It's not necessary. How to treat? Well, with supplements. So it's vitamin B12 supplements. Usually they're really well tolerated. And follow-up blood tests. It can be in 1 or 2 months. It depends on the athlete and the deficiency. So that's it. So next I wanted to talk about some injuries that are more frequent in runners. But before I talk about that, I just wanted to repeat that you know, the symptoms of deficiencies are really similar to symptoms of a lot of other medical conditions. And so that's why I think that if you feel tired or something or anything, just go see a professional to discuss about it. So, all right, so injuries, there's two things I wanted to talk about. It's patellofemoral syndrome and the stress fractures. So patellofemoral syndrome, or PFS, what is it? It's really like, I think a lot of athletes or experienced it, or even non-athlete experiences it too. So usually the symptoms, it's pain around or under the kneecap, and without particular injury. It can even cause like crepitation and sensation of giving way, or that it's not stable. And the pain is secondary to increase or excessive load on the joint, on the patellofemoral joint, as you can see on the image there. So it's usually during knee flexion, there's really a movement of the patella, the kneecap in the groove. And then when you have a loaded knee flexion activity, that really increases the pressure and the load on the joint. And it can also change like the balance or the area of the load on the joint. And that can cause some inflammation of the structures, the synovium around it. And that can cause pain. So factors that can affect the tracking, so it can cause the symptoms, it's really if you have an increased like internal rotation of the femur, knee valgus, tibial rotation. So I think that like, you can see on the picture there. So female are more at risk because they tend to have an increased Q angle and are more at risk of that injury. And like there's other factors here, and neuromuscular control is really important too. So there's many factors that are not there too, but I think it's something overall, I just wanted to mention that it's something that is frequent. And if you start to have symptoms, you should see a physio, a therapist, or someone to help, even a doctor, just because it tends to get worse and worse and worse. And if we don't take care of it, and at some point, it might cause at some point some arthritis or degeneration of the cartilage. And we think that it might contribute to that. So, and also, like if you train with pain, at some point it's going to be really painful to a point where you'll have to decrease or stop training, and it can take a couple of months to recover. So it's something that we don't have surgery, we don't have a magic cure for this or a pill, but it's something frequent, and I think you should see a professional if you start to have symptoms. Then stress fractures. Stress fractures is like an overuse injury of the bones, and it's caused by repetitive stress. And it can start with just like a stress changes to stress fracture. The symptoms, usually it's just a gradual onset. It's aggravated by exercise, and it's very localized pain. And then it can become to be painful walking at rest when it's getting more and more severe. So it's not like one clear injury usually, but if you have a stress fracture and you don't treat it, it might lead to a real fracture after just a fracture that, as you would see usually when it goes to both cortex. So if you don't take care of it, because it weakens the bone where there is a stress fracture. And usually the weight-bearing bones, and risk factors are low energy availability, redness, reduced bone density, fatigue, and for sure anatomical and biomechanical factors. So the X-ray is usually normal. So let's say you see a doctor for a pain with the symptoms like that, and you do an X-ray and it's normal. It doesn't mean that that is not a stress fracture. On the picture here on the X-ray, there's a little callus formation here, and it's not callus, it's a periostal reaction, like we see in a callus after a fracture. But overall, that doesn't, we don't see that at the beginning. It usually takes a couple of weeks. So if you do an X-ray and it's negative, it could still be a stress fracture. We can usually diagnose with an MRI or a bone scan, but that's usually not available quickly. So, or most of the time, it's really like a clinical diagnosis. Like there's typical symptoms, there's pain on a specific area. We do the diagnosis, and we do more tests if necessary. So how do we treat it? Like it really depends on the area, but overall it's a couple of weeks of rest from weight-bearing activities, and then a progressive return to sport. So a couple of weeks without doing your sport 100%. And relative bone health plays an important role in healing of the stress fracture. So I'm just going to talk quickly about bone health. Bone health is really important. When you lose bone mineral density, it's very a slow process usually, and women have generally lower bone mineral density than men. And the peak bone mass, you have it, and then after 30 years old, there's really almost no increase in the bone mass. So it's important to keep a good bone mass and to make sure that it increases as it should. And it's important to preserve it too. And estrogen helps to increase the peak bone mass and preserve the bone mineral density. So for sure, optimal nutrition, nutritional counseling, optimal vitamin D, calcium intake, weight-bearing exercises, staying healthy are all things that can help. What doesn't help with that is estrogen deficiency, malabsorption, any disease, smoke of the gastrointestinal tract leading to malabsorption, smoking, alcohol, and some medication. All right, and another thing I wanted to talk about is really pelvic floor dysfunction and urinary incontinence. So it doesn't only happen to older women or to someone who gave birth to a child, because I see that in athletes, younger athletes, and it's because, and runners specifically, because it's like there's pressure from like a lot of different organs, and with exertion and like exercise and running, and you can have an increase in the abdominal pressure, and the pelvic floor muscles, they have to support everything. So if they cannot contract properly, or if you don't contract the right muscles, then it can lead to leakage of urine when you don't want to, so urinary incontinence. And I feel like with good exercises, it is something that can be treated like relatively quickly and with good results. So I think that some women in general are shy to talk about it, and it's sometimes difficult to talk about it, but I do not hesitate to talk about it because, as I said, with exercises, specific exercises, it's relatively like easy, and we can help to treat it. So that little image there, I took it from a website I'm going to show you like in 2 slides. So that's the pelvic floor dysfunction. Always also good to see a medical professional to make sure that there is not other cause like urine infection or things like that. There's also bladder training that you could do. Also avoid excessive fluid consumption, but for sure you get well hydrated. And avoid shortly before training sessions or competitions. It can help. That's it. So for the last slide, so that website I find really interesting. It's kind of an interactive learning website, and from the International Olympic Committee. So you can log in and it's free, and there's different like subjects, and it's kind of really interactive, and yeah, so I recommend you go and you check, and maybe you're gonna learn other things about female athlete health. So that's it. Thank you.
Definitely very informative. So we can go back to our presentation screen. Perfect. And so I'll let everybody start pondering their questions and stuff. And just a reminder, you can use both the chat box, or you can also unmute yourself and ask your question. But in the meantime, I'll ask my 3 little get to know Gabrielle better questions. So my first one is, what is your best race or sporting event memory?
Yeah, so for that one, I think really to be able to go as a doctor, but to the Olympic Games was really a great memory. I think it was a great experience more professionally, but also personally. I think that, yeah, that's a really, really great memory. Yeah.
Yeah, that would have been super interesting to be there for sure.
Yeah.
Even though it was COVID, it was still great.
Yeah, yeah.
Okay, my second question. So what is your favorite post-race or post-workout food?
Yeah, I think it's a chocolate milk. I was thinking about that, and I kind of realized that it's been a while. I took chocolate milk, but I really like it. So
Yeah, that's a good one. It's classic.
yeah. Really
Yeah. Yeah. And then finally, what is one thing that you learned the hard way in sport?
Yeah, I think there's many things that I learned in sports in general. Learned the bad way. I would say that when I was younger, I did a bit of competition in cycling, but didn't know much about training. And when I started, I kind of wanted to always do more, but I realized that doing more is not always better. And so there's one event I wanted to do, and I just pushed and pushed and pushed, and overall, like, when I was there, I just wasn't able to perform at all. I think I was younger, but I think I had maybe overtraining syndrome or something like that. And a week later, I tore my hamstring cycling, which I don't know how I did. But yeah, so I learned that you need to listen to your body, and sometimes you need some good counseling if you want to train and you have goals. I think it can always help. Yeah.
Great. Yeah, I think that's good advice. Yeah, especially for those maybe getting into running or into a new sport. So definitely listen to your body and avoid overtraining.